So coming to the basic anatomy of the eyeball, what all things we'll see here: the shape, volume, size and all, and about the layers. Majorly the structure of the eyeball. So what is the shape of the eyeball? Shape is aspherical. What do you mean by aspherical? It is majorly like oblate shape. Oblate means like rugby ball you have seen, that is the shape of the eyeball. Then coming to the volume, it is 6 ml, and the site is eyeball is present inside the orbit. And where, what is that? In the bony cage in the skull. Now axial length, what do you mean by this axial length? Axial length means the anterior and posterior diameter, anterior posterior diameter, which is around 24 mm, which is equal to 2.4 centimeters. So this is all about the structure of the eyeball. Now coming to the layers of eyeball. Now there are three layers of the eyeball. One is outermost, then one is middle, and the other one is the innermost. Outermost we have three parts, we'll see. One is the cornea, then next is the limbus, and the third one is the sclera. Let's see the structure first. If we draw like this, majorly this is the this part is known as the anterior chamber, and here this area we call it as cornea, and the junction, this from here to here, it is sclera, and this junction is known as the limbus. So this forms the outermost part. This cornea forms the anterior 1/6, then sclera forms the posterior 5/6 part of the outermost layer. Now this cornea is transparent and it is convex shape. You can see here it is convex shape, and it has a refractive power is present. Okay, then limbus is the corneoscleral junction. Okay, this is the corneoscleral junction. Then coming to sclera is actually white and it is opaque. Okay, and it is covered by conjunctiva. This sclera, this part is covered from here to here. The sclera is covered by conjunctiva. And what do you mean by conjunctiva? Conjunctiva is a transparent mucous membrane. Okay, now this cornea, now this is transparent, that means light can pass through this cornea, but this sclera, this is white and opaque, so light cannot pass through this sclera. Okay, now coming to the middle part, it is majorly the vascular layer. Okay, vascular layer means they supply blood to the eyeball. Now what is the parts? This part, this is iris. Then coming to this ciliary body. Now ciliary body is divided into two parts. One is pars plicata and one is pars plana. So here like this, it is the ciliary process. Then from here we will see plana. From here we will see choroid. Okay, choroid. Again from here we have this ciliary processes, then the pars plicata, then pars plana, then again choroid. This is choroid, this is pars plana, and this portion is pars plicata, and this two forms the ciliary body. So the pars plana, this is relatively avascular. Okay, majorly this middle layer is vascular, but this pars plana is avascular. Now this forms the middle layer, and this ciliary process, they will secrete the aqueous humor. Okay, they will secrete the aqueous humor. Now aqueous humor is secreted by this ciliary process, and the rate of secretion, it is 2.3 microliter per minute. And what is the function of it? It exerts the intraocular pressure, which is measured by tonometry. Okay, now outflow, the aqueous outflow, it majorly occurs through trabecular meshwork and uveoscleral outflow. So here the trabecular meshwork is present, so outflow of this aqueous humor occurs at a rate of 0.25 per microliter, means microliter per minute per mmHg, via this angle of anterior chamber. We'll see the chambers. Now the depth of this anterior chamber is around 3 mm, that is 2.5 mm to 4.4 mm, varies. Now this is measured by tonography. Okay, now we will see the innermost layer. Innermost layer is retina. Now this is an incomplete layer, the neurosensory layer, and it is present here. near the choroid. Okay, and what is present here near this ciliary processes? We have the lens. Okay, ciliary process, we have the lens. Now this part is known as pupil, and this is the iris. So this area, this is the anterior chamber. Then this area is the posterior chamber. Now this anterior chamber and the posterior chamber together, they forms the anterior segment that contains the aqueous humor. Okay, now what do you mean by this anterior chamber? Anterior chamber is the space between the cornea and the iris, and posterior chamber is the space between the iris and the lens. Then this part, this is the posterior segment. This is the anterior segment is comprising of anterior chamber and posterior chamber, that is anterior segment, and this part is the posterior segment. Now posterior segment contains vitreous humor. Vitreous humor is actually 1% hyaluronic acid, which is a gel-like consistency. And the lines which you can see between the ciliary process and the lens are known as the zonules or the ciliary zonules.